Hi guys, Dr. Camille here with more clinical insights and wisdom keys. Today I want to talk about the presentation of ADHD in children. So, getting into a little bit of brain neuroscience, certainly dopamine and norepinephrine are the key neurotransmitters that are implicated in ADHD and other dopamine deficient disorders. In terms of children, what parents sometimes complain about is what we describe as a social and emotional lag, meaning there's a disconnect between the child's emotional age and their chronological age. For example, a parent may reprimand the child, and then the child becomes emotionally labile or crying or throwing tantrums that are not on par for a child of that age. Other things we may see is that the child is unaware of social cues. They're having problems with their same aged peers. They have difficulty reading the room, not understanding how they're coming into a room, being boisterous and noisy, particularly if it's a quiet setting, or understanding how to conduct themselves in academic environments and certainly also in team sports. And unfortunately, sometimes they get the cold, hard feedback from their peers where someone might say, I don't want to be your friend. And then that's disheartening for the child. In terms of impulsivity, sometimes they have difficulty waiting their turn for toys or waiting in line, and they might be cutting people off in conversations. Deficiencies in dopamine and norepinephrine impact brain maturation, right? It impacts how the child's brain matures, where they're not getting appropriate input of those neurotransmitters to help them develop appropriately and into whole and healthy adults. Certainly in my work, I do prescribe medications, and this is not about medication advocacy, but it is for help for parents to understand what is the most kindest thing that you can do for your child. And sometimes giving them medication is that because it's raising the levels of those neurotransmitters that the child's brain is deficient in. For me as a provider, hearing a patient of mine saying, Doc, I don't like who I am when I'm not on my meds. This is heart-wrenching. And for them verbalizing and advocating for themselves that they recognize that there's a difference when their brain gets what it needs. Just some food for thought and clinical wisdom so you could continue to heal with Dr. Camille. If you like this kind of content, continue to like and subscribe, and I'll be back with you next time. Thank you.